Welcome, everybody. Thank you for joining us and our Ask the Experts webinar. I'm Elizabeth Shatkovsky. I am the Social Services Manager for Hospice of Southern Maine. I have an LCSW, Licensed Clinical Social Worker, and a denominational endorsement from the Society of Friends. I supervise all of the social workers and chaplains that work here at Hospice of Southern Maine.
I'm Marjorie Dugan-Schoonover. I'm a certified hospice and palliative care nurse, and I am responsible for the nurses and health aides in the home program here at Hospice of Southern Maine.
And today we're going to talk to you about advanced care planning, and we will have some resources available for you that will be sent out to you at the end. But we will be looking at tools and talking about examples, and please let us know if you have any questions. You can send them in. And I'm going to start sharing our slides. So what is advanced care planning? It's a process that requires understanding, reflecting, discussing, assimilating, revisiting. And it takes into account the person's current health status, values, and preferences. And it is to identify and communicate what is most important to the individual to live well at the end of life. The importance of advanced care planning. Most of us will die after living with a chronic and progressive illness. 80% of deaths will occur under the care of healthcare professionals. Up to 50% of people cannot make their own decisions when they are near death. Health professionals typically treat when they are uncertain of the patient's wishes. Loved ones often do not know a person's wishes. A discussion or a series of discussions can help, and documentation gives confidence to those decisions. There are a lot of benefits of advanced care planning. It honors patient autonomy throughout their life journey. Improvement in symptoms of depression is another benefit. Increase in patient belief that their physician understands their preferences and cares about them. Better preparation for the death and dying process. Loved ones can be an advocate for the individual and help them achieve end-of-life wishes and goals. Some elements of successful advanced care planning include, or that it promotes shared decision-making among individuals, loved ones, and health professionals. That's a really important success of or important element of good advanced care planning is that there is shared decision-making among all of the people that are important to you and you yourself. It helps the individual understand options and decisions within the context of their own values and preferences, respects the patient's values and right to self-determination, helps loved ones see that following the plan is a loving act, clarifies roles and responsibilities of caregivers, surrogates, POAs, authorized representatives, family members, and any other person who wants to help you through this process. So what are some of the barriers to advanced care planning? So first we'll look at the patient's perspective. There can be an avoidance, and it may be a coping strategy, because for some people talking about death and dying seems to make it happen. It makes it more real. And so it's easier just to avoid talking about it. There are concerns that loved ones won't agree with their wishes or that they will be hurt by the discussion. So sometimes people want to protect their loved ones and not talk about their own death or the treatments that they might need at the end of life. So they also are worried that sometimes their loved ones won't agree with them, but that would be a reason to go through this process, is so that you can get on the same page. The barrier of relying on the physician to raise the topic, but since the physician isn't raising it, it doesn't seem necessary or the right time. So some people rely on their healthcare provider to be the one to bring up these important topics and discussions. Also, that there's a fear that they won't be cared for at the end of life if they have an advance directive or a DNR. So there's some misconceptions about what these tools do and don't do for you. So some people have fear around that. Some other barriers are health literacy. There are many people that don't have a lot of experience in the healthcare system, and so their understanding of medical terms or choices isn't very high, so then they avoid talking about it. Another barrier is cultural norms. Certain cultures don't talk about these things in public, or they keep things very private, and so then it may make it difficult to talk about advanced care planning. There can be language barriers. If English is not your first language, but that's the language that's being used by your doctor or your lawyer or other healthcare providers, it can make it really hard to make your wishes known. And there are more barriers. And from the healthcare provider's perspective, there are also barriers to advanced care planning. For the healthcare provider, it can feel very personal, that they're asking someone to talk about core values and beliefs, especially if the patient hasn't raised the topic. So we have this dynamic where the patient's waiting for the doctor to bring it up, the doctor's waiting for the patient to bring it up. And so sometimes it's great to bring a family member to an appointment, and then that person can bring up the process. So it doesn't always just have to be on you to bring it up, but somehow you've got to start the process. For the healthcare provider, it may elicit really strong emotional reactions to the patient and their loved ones, and they're touching on deep feelings and fears. And so doctors want to avoid that too sometimes. And so they may be waiting for the right time, but really any time is the right time. The right time is when you start doing it. And so the doctor isn't always aware of when that might be because they're afraid of the emotional reactions. Also, we may be unsure how to start or finish such a conversation, and that we don't want to appear lacking in appropriate skills. So these can be tricky conversations. They're obviously very deep conversations, and especially if you only have a limited amount of time with your patient, like 15 minutes, it doesn't seem like maybe they're going to be as skillful in having a very effective conversation in a short amount of time. So sometimes that's another barrier. And it may raise issues that are difficult to resolve or questions that are difficult to answer. A lot of times there are no answers in the beginning of these discussions, a lot of questions and a lot of curiosity, but that may stop a healthcare provider from raising it because they're worried about leaving somebody with a question that's not answered. The conversation is complex without a clear endpoint and time consuming. And so there is a need to revisit this conversation. So that could be another barrier for the healthcare provider, is making sure they have enough time to set up those appointments and really get to the need of this conversation. So studies show that 80% of Americans would prefer to die in their own home if possible, yet only about 20% of us actually do. About 35% of all hospice care in the United States is provided in nursing facilities, with another 10% in assisted living facilities. The past 2 decades have seen a rise in long-term residents dying in nursing facilities as opposed to in hospitals, which is generally preferable to people. Studies suggest that nursing home residents who use hospice are more likely to have advanced directives, choose treatment limitations such as do not resuscitate and do not hospitalize, and they experience lower rates of terminal hospitalizations. While each of us would like to be as prepared as possible for end of life, it is easy to move this type of work down on our ongoing list of priorities. Advanced planning may help to reduce or minimize stress by knowing that you have prepared for whatever the future holds for you. Our experience here at Hospice of Southern Maine is that people who have visualized and prepared for their future can rest a bit easier when challenges arise, since they have plans in place. Having plans in place also brings confidence and peace to your loved ones because they know what is most important to you and what your wishes are. They are able to follow your advanced plan care, like a map or a recipe for providing you with the care and support that you've chosen. Now Marjorie is going to talk to us more.
So like most of you, I wear many hats in life. And I just want to share some examples of different scenarios that you may have been faced with or maybe have had similar experiences in your life. As the saying goes, the one certainty in life is that things will change. And I have been a daughter, a parent, a sibling, and a friend. And I came to hospice 20 years ago from a background in epidemiology and critical care. I saw many patients in the intensive care unit who wound up with far more medical interventions than they had initially intended or wanted. And I saw families having to make really difficult decisions and feeling overwhelmed and confused. And it was heartbreaking to watch. And I thought to myself, there has to be a better way to do this. Around that period of time, I worked as a library volunteer with a gentleman who was a hospice volunteer. And every Saturday, at some point in the shift, he would turn to me and say, "You need to work for hospice." And so after a time, I took his advice and I found my home as a healthcare professional in hospice. We help families every day navigate end-of-life decision-making, and we've learned from experience that the better you have armed yourself and your family with decisions made in a thoughtful and deliberative way, the better prepared you'll be down the road in a time of crisis. As the daughter of parents who each had 10-year periods of decline with dementia, my siblings and I had many decisions to make about their care and how to meet their needs at any given point in time. It was not easy. We did not always agree on every detail, but in general, we were guided by our knowledge of their wishes, which helped us make some really difficult decisions. It was important to us that we each felt heard and that we talked through the options and supported one another. We each brought different strengths and skills to the process, and we respected each other's abilities at the end of the day. As a single parent of 3 children, I needed to make decisions about my own wishes and communicate them to my family. When my children were younger, I did not want to burden them with decision-making and had designated a sibling as the point person. Now that they're older, I am more comfortable placing that responsibility with them. Another thought is that the person closest to you may be too overwhelmed with anticipatory grief to make decisions, and you may not want to rest that responsibility with them. Look at those in your life, friends, family, and think about where their strengths are and when you're making your choice of who you want to designate to be your decision maker, those are things to consider. Talk with them about what your wishes are. Shortly after I came to Maine, one of my best friends, a fellow critical care nurse and mother, had a sudden cerebral hemorrhage and was declared brain dead at the age of 56. Her husband and children were well versed in what her wishes were after many conversations around the table about what she had seen in the time she worked in the ICU. She became an organ donor and was able to give new life to 4 people. You may have had some similar experiences in your life, and this is why we encourage you to prepare documents to guide those involved in your life as things continue to change. We'll talk to you about some of the specific tools that you might use to organize your thoughts and wishes. And these documents aren't necessarily written in stone, and they may require revision from time to time as your circumstances change.
Thank you, Thomas. Yeah, let's start looking at some of these documents. So the Maine Healthcare Advance Directive form is specific to Maine, and we really like using this because it's clear and it's pretty simple. It really takes you step by step through what needs to get completed. And I'm gonna show you sort of the first pages of these things, and you won't necessarily be able to read everything on your screen. That's why we're going to send you the resources after our presentation, but at least it'll look a little familiar to you from having it flashed up on the screen. So in part 1 of the Advance Directive, excuse me, there are you're going to be designating the power of attorney, and I'm trying to get to that part of it, or your healthcare surrogate. That was something that Marjorie had touched on in her explanation about why advanced care planning is so important. And this is where you really get to think about and talk about what is most important to you in choosing that person. And there are some guidelines, brief guidelines that could help you make that decision. Then you write down the person's contact information. They do ask for 2 choices, or actually 3 choices, because if the first person can't be contacted immediately, then you want to have a couple of backup people. And it's really great to fill out this page because then people know how you're thinking about them and what you might be asking of them as you near the end of your life. And they may have questions and want to make sure they're on the same page as you. So the sooner you can start figuring out who that is, you can have these really important conversations. Part 2 does not have to be filled out if you have designated a POA and they are clear about what your wishes are. Part 2, you can fill out in addition. This is where you have special instructions, and it includes if you have any considerations around life-sustaining treatment or artificial nutrition, which you may want to put in to your advance directive as well as a POA. But if you have the POA and you feel confident that they are going to be able to follow your map that you have laid out, then you don't have to fill out part 2. And then part 3 is making sure that everybody knows who your primary physician is and writing down your physician's contact information, and that it also gives permission for the POA to speak with your physician, so that if your healthcare surrogate or power of attorney has any questions, especially around medical issues, that you've given permission for them to speak to each other. Part 4 covers body donation or organ donation. A lot of people would like this to be a possibility if they die suddenly and their organs could be helpful to somebody else. So if you would like that to happen, it's really easy to fill out this form. Part 5 is the instructions about funeral and burial arrangements. And this can often be a great way to start a conversation with your family or your POA. It's a little bit less charged maybe than end-of-life treatment options. And it can actually be a fun conversation, or it can be a way that you reminisce about memorial services that you've gone to together, and you're remembering the people that are gone that you still think a lot about, and how was their memorial service? Did it honor who they were? And so if you have specifics that are really important to you, we really encourage you to write it down. This is an area that may change as you get older, and that you may change what you want to have for a service, or who you want to be in charge of creating that service. In Maine, we now have the possibility of a green burial, which some people have now changed their advanced directives to include that as a possibility. And then signing the form. So you're at the end, here you are. And you have to sign it, you have 2 witnesses that sign it, and then you need to get it notarized. That's all that you really have to do, besides making this available to any emergency medical services. Then they can follow your map because it's been written down. So if you give your advanced care directives to your doctor and to your POA and have a copy somewhere in your home, then your wishes are more likely to be followed when that time comes. And a piece that can also be part of the advanced care directive is the do not resuscitate order. As you can see, this is also a very simple form. And it is very important because it will direct what your end of life experience will be like. Marjorie is going to talk more about that.
Well, so the DNR form is important, if or whether you wish for resuscitation or not. The other form that we're going to talk a little bit about is the POLST, and that's short for Physician Orders for Life-Sustaining Treatment. So the difference between a POLST and an advanced directive is that a POLST is actually a medical order, and it's completed by a healthcare professional along with an individual, and it's considered to be something important to have for anybody who's got an underlying serious illness or at risk for a life-threatening clinical event because of their underlying conditions. And so the POLST does not identify who your surrogate is. It's really a set of physician orders to guide medical personnel in an urgent or emergent situation. So it delves into more detail. It includes information about resuscitation, whether you wish that or not. Then it talks about the level of medical intervention that you might want. Do you want the soup to nuts? Do you want all possible interventions? Do you want limited interventions, or would you prefer just comfort measures only? It also talks about antibiotics, if you want the use of antibiotics. It also addresses artificial nutrition, whether that's via a feeding tube or IV intravenously. And also you want to address mechanical ventilation. So it's a good tool to have. It's a good tool to have readily available in your home should you require emergency medical intervention. It's good to have that available. and have it scanned into your record by your healthcare provider so that it's accessible to all.
We have a few different checklists that we like to use. This one is a good summary, and we got it from the Death with Dignity group, but you may find one that meets your specific needs better. This encompasses a lot of the things that we think are important for people to think about. At a sort of 50,000 foot view, you really want to make sure that your data and documents are organized, that you create a password list, that you have reviewed your social media accounts and decide what you'd like to happen with them when you die. Sometimes when there is nobody in your family or friends that knows your passwords to these, your social media accounts continue to be going and can sometimes look active, and that can be very jarring to your loved ones. Document your bank account information, including a safe deposit box and its location. If you have keys to that, where are they? How much is in your accounts? What are they designated for? Document any life insurance policies and beneficiaries so that that process can get started sooner than later. Include your will, make sure that people know where a copy of your will is. That would be something that you prepare with a lawyer, and that you make sure that either your POA or your executor would know who your lawyer is and where the will is. Make a list of your bills with the due dates and the amounts. That can be something that falls through the cracks when somebody dies because there's so much else to do. But if you own a home or have an apartment, you definitely want, the power to stay on and the water going so that people can go there and figure things out and get things arranged. Then we did already talk quite a bit about your care. That's the second section. Creating your advance directives are very important. There are several different kinds of tools and resources, so find one that works for you. Make copies of your advance directive and give them to your healthcare surrogate, your doctor, and have one at your home. Talk to your physician about your advance directives. You can also explore using a pulse, which Marjorie explained. Also, your physician is going to explain what a DNR is and what that means for you with your current diagnoses and possible decline. Have multiple conversations with your healthcare agent, also known as the POA, about your wishes. It's great to have the person listed on the form, but what's really important is to have those conversations about what you want to have happen, how you want to be cared for, what life-sustaining measures you do want or don't want, so that person can act accordingly and feels like they are fulfilling the responsibilities that you gave them, and they feel confident that they're living into your values. And then we all have possessions. Many of us have too many possessions. So it's a great thing to try to go through anything that's really valuable to you and designate who that would go to so that your family isn't trying to figure that out later. Have meaningful items go to specific people if that is something that's important to you. And dispose of any items that you wouldn't want your heirs to have to deal with or find. Some people have letters they really don't want anybody to ever look at, or journals, or they may have some other items that they just don't want their family to ever see. So try to get rid of that ahead of time. Then you want to make sure that people know if you have any cash stored in your house, because that is something that could easily be thrown away if we don't know the location of that. And you can write up a little where to find list so that all of these things are marked down so that somebody is not wondering like, where's the key to the cellar, or where's the shut off switch for this, or where are the vet records for the cat and the dog, because I really, want to make sure I'm taking care of them properly. So if there's anything that's important to you, you can just start a running list and let people know what the status is. A lot of people like to think about their legacy and what they want to leave behind in an intentional way. So some people want to write their obituary. We have, in our line of work, have had amazing obituaries that honor sort of the essence of the person. It's not a resume. It's not saying every single thing they've done in their life, but it really captures who they are. Some of them are very funny. Other ones are very spiritual. But it really, if that matters to you or to you and your family, that may be something to think about now and to have a part in. Write down your instructions for your final disposition. So what happens to your body once you die? Where do you want it to go? How do you want it to be taken care of? These are things that are very important to survivors to know, because they want to do what is going to honor you, and they want it to fit with your values. And some people want to be part of creating their own funeral or their own ceremony. Other people don't want to be part of that. They feel like that's for the people who are living, and they designate somebody to organize that. Some people really want to have a message that they leave for their loved ones. So some people write letters to family members. They might make a video that then their family can keep. Some people write poetry and they put it together in a little book. Some people gather photographs, or they have photographs taken of themselves now with loved ones. So it really just matters what's important to you. How do you want to be remembered? Is there something tangible that you want to leave behind for your loved ones? And then try to organize this stuff so that it's easy to find. I like color, so I would probably put mine in a purple folder so somebody could easily find it. Other people have a safe deposit box. Other people have a plastic file folder that sits in their kitchen. Sometimes having the documents sort of accessible is a really good way to pull them out to talk to a friend or to talk to your POA or your family member. A lot of times people find it less scary to talk about these things when there's even like a little outline, like just like file checklist to look at and pick items off of. It seems less overwhelming. So whatever works for you, but try to put things on paper and keep them organized.
Good advice.
Oops. Yay! And we hope that once you have done it, that you will feel like this. We like to say that this is a family that has just had a very meaningful conversation about advanced care planning.
Now, we have some questions that came in. So, Elizabeth, may I ask you a question?
Oh, please.
All right. So, this can be a tricky thing to talk about, and sometimes family members are uncomfortable or reluctant to have conversations. How would you suggest people handle a reluctant spouse or family member and engage them in a meaningful conversation?
Well, I think that everybody comes to this differently. It depends on the experiences that you've had in your own life. And in our culture, we have a lot of fear about getting older and dying. So I would say dying has a bad rap. And so a lot of people don't have words really that can encompass how they feel. They haven't had a lot of experience talking about death and dying. And so I think it's to really honor where that person is at. They might be very afraid. They might be having anticipatory grief, thinking about their spouse dying. And so I think it's finding out where they are and what they think about these things first, so that you can start where they're at. And then I think there are lots of ways to start this conversation. And it's not just a one and done conversation. So you could be watching a movie together and somebody's sick or somebody's dying. And then you could say, oh, if that happened to me, I would like this and this and this to happen. Or if this was happening to you, how would you feel? So there are some ways that you can kind of bring it into every day. Some people feel more comfortable like setting up a time, like let's go get our, favorite coffee and sit and talk for a limited amount of time. I would suggest setting an amount of time that could make the person feel more comfortable, that it isn't going to go on for hours and hours. And also that once it's over, you're going to talk about something else. So you could set a half an hour to begin with. Also, there may be a neutral person that would be helpful to have to be part of the conversation. Even though a lot of times these are very personal or intimate wishes you might have, sometimes having a friend or a family member there with you can make it more universal. And that person is a trusted third party who can make it feel safer. So sometimes having more people in the conversation could actually make it happen more naturally. So those are some of the ways, I think. And I think just to also name it at the beginning that it's uncomfortable for everybody to talk about this, that they shouldn't feel ashamed of it, and that it is important to you. I think a lot of times our loved ones will have a conversation with us when we say that it's important to us. So Marjorie, we had a few questions from people who had specific diagnoses and wondering how advanced care planning could help them. One person was asking how to plan for a person who has dementia as their disabilities increase. Another person was saying that they wondered if there is a specific dementia care advance directive. So how would you help somebody plan who has dementia or is the caregiver of somebody who has dementia?
So, I have some experience with this. It varies. What I would say is have conversations when the person is optimally functional and able to have a dialogue and get some sense of what their wishes are, and then incorporate those into your longer term care plan. You might, while someone's still relatively functional and in otherwise good health, you might opt for more interventions or a greater intensity of interventions than you would if, say, someone has very advanced dementia and is bedbound and having difficulty with eating and drinking and swallowing. You might make different choices at that stage of the illness. So I think it's important to get a sense of their values early on in the diagnosis, and then try to follow that as things go along and disease progression occurs. Elizabeth, a question came in that said, how do you choose POA when you have no family? Are there some guidelines you could give people or suggestions for how to select a POA?
Well, in the advanced directive form that we talked a little bit about, it actually has very basic guidelines about what the POA has to do. So that might help you start to think about who in your life could do those things. And a lot of us think, oh, I need an executor, I need a POA, and who in my family is going to do that? Because those are usually our closest people. And often it is family who fill those roles. But what you really want to look at is what is the function of that role? And who do I know that can do those things? So the POA, you want to choose somebody who feels comfortable in a medical setting. who knows medical terminology or is willing to learn it, and who is really willing to stand up for you and advocate for you, because that's what you can't do right then. And so you need somebody who can do those things. So that could be a good friend. Maybe you watched a friend go through the loss of their parent or a spouse, and you were really impressed with how they did that. They might be willing to be your POA. It could be a relative, and maybe not the closest relative. Sometimes it's really hard when you're the closest relative to be the one that is that advocate. And so you could get a little bit of a distant relative and explain to your close family, this is the person who's going to be doing the advocating. You're going to be doing, holding my hand or sitting near me, singing. There are lots of things that people can do for you. And so sometimes having the POA not be a really close family member can be a good thing. But it is a really important thing for you to be thinking about and to be discussing with the person who you think might be that person. They also need to share their values. Most people do willingly accept that position, but not everybody. And they need to be able to say no, because then you want to move on to somebody else. So having these discussions with a possible POA can also help you practice having these discussions with your family. Yeah. And Marjorie, somebody wrote in and they said that they are 50 years old and recently diagnosed with ALS. So I'm sorry to hear that. And they're wondering, what kind of recommendations would you have for somebody in their situation? Another person also wrote in and said that they have a cancer diagnosis. And so how could doing advanced care planning help them?
So I think those are good questions. I think both of those are life-limiting illnesses that progress over time. So I think it's less about what your diagnosis is and more about what you want for yourself and what you hope for in terms of the level of intervention that you think you might want. I think it's giving thought to the issues kind of outlined in the post. Do you want resuscitation? Do you want mechanical ventilation? Do you want antibiotic therapy or hospitalization? Do you want dialysis? Do you want, let's see, what was the other one on there? Artificial nutrition and hydration. Those are the big ones that most people should probably think about and want to include in their conversation about what's important to them. The other piece is level of awareness. Some people, it's really important to them. There are people who maintaining control is really important, and they want to be optimally alert and awake through the entire process if possible. And there are other folks who are not so comfortable with that, or who just, to them, they're worried that they're going to be in pain, and they don't. Above all else, they want to be pain-free. And they might accept being a little sleepier in favor of better pain control. There's also situations where you might, it's a decision about where you want to be geographically. Do you want to be in a home setting? Would you feel better in a facility? Would you, it's thinking about where you want to be geographically and physically, and what's really important to you. And those sort of relate no matter what the diagnosis is. Any life-limiting illness, those are the things that you want to consider, I would say.
So it sounds like there are some of these things that are very based on our values that we could, even as a young person, have an advanced care directive. And then as we get closer to dying, and maybe we even know what the diagnosis is that we will probably die from, that we may have other choices that are more specific.
Mhm.
And I think, you talking about people's choices around being aware and awake versus how much pain they're willing to be in. That to me, I think we see how that plays out at the end of life a lot. And that the person who is the caregiver, the POA, is the one that's really helping to amplify that choice, whatever that is. And that is often one of the things that many family members remember about the end of life is that mom was in pain. You can see her gritting her teeth, but she was happy that she knew who we were and that we were all there with her. And so that gives them a sense of peacefulness and that they did what their mom wanted. I think one of the things that we want to make sure or get the message across is that having these things outlined really help the grieving process for the people who are still living. So the family members that we want to feel good about the choices that they made for our care. And so,
yeah, it's an ongoing conversation, but it's always better to have it not in a moment of crisis. But some families, don't get there. And so decisions are made in crisis. But I think we try to avoid that and help people give some thought to what their wishes are before you get to the crisis. I think at the end of the day, that is beneficial to all. So, and we hope
that once you've been doing your advanced care planning, that you feel as excited and happy as. So thank you for joining us.
we hope this has been helpful to you, and that you'll think about what it is that you would like to do. And there are wonderful tools out there, and go forth and conquer.
Go forth. And Mom, I'm willing to help you. And actually, we're willing to help anyone. You can call us, we'll help get you the materials, and we will point you in the direction of support that can get you to where you want to be with making your arrangements. So we will have all of the resources that we mentioned and some others sent to you. So thank you very much for participating in this webinar, and you'll be able to look at the resources in more detail when you have time. And this recording will be put into our Ask the Experts library, which is on our website. We have, I think, 10 others there now, so you might want to check out some of those. There are a lot of interesting topics there. And thank you very much. We hope that you go forth and make good plans and have a good time doing it. Take care.